Well, welcome. I'm Dr. Brent Wright, and I would like to express my thanks to the Foundation for a Healthy Kentucky for asking me to moderate the Bost Forum panel on vaccine hesitancy. As I welcome you today, it is somewhat bittersweet that we are not meeting in person, and the backdrop of this meeting has so many Kentuckians admitted to hospitals, on ventilators, or planning farewells. I want to be able to meet again for this Bost Forum in person, and like so many of you, to return to a sense of normalcy that existed before this pandemic. The pathway to putting this pandemic behind us is through vaccination, and one of the roadblocks to that end is vaccine hesitancy. Vaccine hesitation is nothing new and was on the radar of the World Health Organization as one of their 10 most important issues to address even before COVID-19 was ever known. This is an important topic for us to dive into today, as it is not simply about getting vaccinated, but getting to the vaccine through all of the hesitancy. It is about addressing the issues that people have that make them feel that the vaccine may not be the best thing for them, their family, or their friends. The items that make people feel hesitant revolve around trust, personal history, partisanship, family history, social media, misinformation, misunderstanding, personal beliefs, and many more items we will address today. And here to help me with the issues surrounding vaccine hesitancy is an expert panel that represents so many areas of healthcare. We have with us today on our panel Dr. Melinda Joyce. Dr. Joyce is the Executive Director of the Western Kentucky Heart and Lung Research Foundation, which works in conjunction with MedCenter Health, where she served as Vice President of Corporate Support Services before her recent retirement in July of this year. In her role with MedCenter Health, she focused on quality, patient safety, patient satisfaction, survey readiness, and performance improvement initiatives. Dr. Joyce was instrumental in the many COVID response efforts of MedCenter Health, including vaccine administration. Dr. Joyce is a graduate of the University of Kentucky College of Pharmacy and still continues to teach pharmacology to nursing students. Dr. Monalisa Tailor. Dr. Tailor is a Kentucky native originally from Bowling Green. She is the daughter of Indian immigrants who are self-employed business owners. In college at the University of Kentucky, she earned a degree in political science before attending the University of Louisville School of Medicine to pursue her MD degree and complete her residency. Currently, she works for Norton Community Medical Associates, Barrett, and is deeply invested in the care of the community through her service on various boards and committees. Dr. Tailor is very active in leadership within medicine, serving as the immediate past president of the Greater Louisville Medical Society and president-elect for the Kentucky Medical Association. Delanor Manson. With degrees in nursing and healthcare management, Delanor Manson is a visionary leader whose career has focused on innovative medical initiatives in both patient care and complex administrative settings. Delanor currently serves as the Chief Executive Officer for the Kentucky Nurses Association. Prior to joining KNA, she was the Associate Vice President of Research and Design for Hospice Health. She also served as Deputy Secretary for the Kentucky Cabinet for Healthcare Services and in various leadership roles within hospitals and healthcare organizations nationwide. With 27 years of service, Delanor achieved the rank of captain in the U.S. Navy during her military career. She applied her nursing education to various positions throughout the country, as well as internationally in Japan, Great Britain, Germany, Italy, and Puerto Rico. Welcome to our esteemed panelists. Let's jump into our questions. Dr. Joyce, it's hard to believe that we are even having this discussion today. COVID-19 is a terrible disease, and we have a vaccine for it, 3 in fact. Could you help us get started today and take a deeper look at this topic of vaccine hesitancy?
Yes, thank you, Dr. Wright, and it's a pleasure to be here today. When we first started with the vaccine clinic in MedCenter Health in Bowling Green, as well as in our other outlying areas, we had so much demand. We had way more demand than at times we had vaccine. In addition to that, at times we also had much more demand than we had times during the day. We often thought that we could actually give vaccines 24/7 and would have been busy for the whole time. And then once that initial group was vaccinated, we started to see this significant decline. And when talking to different people about this decline, we heard so many different things from people. We heard the research issue. We heard the fertility issue. We heard the reproductive issues. And then after we tried to work through some of that, we started to hear just overall distrust with the medical system as a whole. And that really was one that was very difficult for us to answer. But, I think with all of the panelists here today, we all have seen so many different things, and our approaches have been very different. But still, the whole idea is, as we've heard many times, how to get that shot of hope in arms as much as we can.
Thank you so much, Dr. Joyce. I mean, it does strike me as interesting in the beginning, people were ready. They were there. They were in lines. And Kentucky likes their basketball. So I like to break things down into quarters, and it seems like the first quarter, people were ready to go. Second quarter, still in the game. Halftime came along. Now we're in the third quarter, and to me, the third and fourth quarters are about vaccine hesitancy. And I think vaccine hesitancy lives on a spectrum. We've got the people who are leaning into the shot, but are still hesitant. And then we have those people on the other side of the spectrum. They may have certain terms. They just don't like vaccines in general. They especially don't want this COVID vaccine. I'm going to go to Dr. Tailor, and maybe if Dr. Tailor could talk a little bit about the things that she's hearing in the office. She's on the front lines. She's seeing patients every day. She's encountering hesitancy, right there in the exam room, in the eye. Delanor, I'm going to go with you to a question. I think we hear a lot about communities of color and hesitancy and resistance and maybe not getting the vaccination rates as high as other communities. Could you comment on that and what's your approach and your understanding?
I'm delighted to be invited to be on this illustrious panel, and that the Kentucky Nurses Association speaks for 90,000 nurses. And so we've been out there on the front lines doing vaccines and testing, and a lot of education during vaccines and testing. When it comes to the communities of color, there's a long history of distrust of the government and of the healthcare systems in general. When I talk about the why, I think we have to look at the history first. I mean, during slavery time, slaves were being experimented on without their permission. We have African women who were sterilized, Native American women sterilized, Puerto Rican women who were enrolled in trials for birth control pills, and they weren't told that about adverse effects. Native American women, as I mentioned, being sterilized, but just as recent as the 1990s, the diabetic study that was done on Native Americans, they thought that they were giving blood for diabetes testing, and yet their samples were being used for a lot of other experiments and data collection. So it's the history that plays a large part. And then what's happening right now? When African Americans and brown and other people of color go to nurse practitioners or physicians, and they're not treated with respect. By my first name. They don't even give me my title of Mr., Mrs., or Ms. Or they make me wait a long period of time when people who were white came in after me and they were seen before me. So things like that where we have the history of mistreatment by the government and healthcare, and then what's happening today. They do not feel as if they're getting adequate treatment and care as white people would. So those are some of the issues that we have to address.
Very good. You mentioned something very important there, and something I hope would come up, and that is the issue of respect. Because when we talk about vaccine hesitancy, we're dealing with people at multiple levels, socioeconomically, educationally, and their understanding of vaccine, much less an mRNA vaccine that is newly developed, or really not newly developed, but 3 decades in the making. It's hard to have those discussions. So I think getting to that foundation of respect is so vital. So in that vein, I think that's a good segue to get Dr. Tailor in here. And Dr. Tailor, could you talk about, we've talked about, fingers crossed, we've talked about some, Dr. Joyce helped break the ice for us. Delanor, got into the communities of color and issues, and we're talking about respect. And, talk to us about the exam room. What are you seeing? What are the misconceptions out there?
Dr. Wright, while we're working with Dr. Tailor's, with her microphone, some of the things that I've heard on this end when at the vaccine clinic, for people that didn't want to come in, we heard so much of well, it's so new. It's so new. And I loved your comments about respect, because I learned kind of the hard way talking to some folks about the efficacy of the vaccine. And at the end of it, I thought I'd done a lovely job. And I heard somebody say, well, does it work? So I realized that my lovely presentation really didn't hit home, and that you had to tailor the argument to the person you were talking to. And I use the term argument loosely because, again, with respect, you don't actually argue with someone. You listen to them and take in what they have to say. But I really heard a great deal about the fertility and the reproductive issues. And I think that's one that is still very present in a lot of people's mind. I mean, people know that COVID can cause issues for both mom and baby, but they're very, very worried about what if something happens to my baby because of this vaccine. So I think that's something that is still very much present in people's mind, and one that will take a little bit of effort once we get that done. And I know Dr. Tailor can talk about that in much more detail, but I think that is one issue that we really have to think of. I've heard all kinds of things. I know you all have as well. Probably my favorite is the fact that, we are now magnetic. I have walked by my refrigerator, and I promise I didn't attach to it. So, it's been a variety of different things. And I think all of us can kind of share some of those things that we've heard.
Going along with that, though, Dr. Joyce, it's really important that while some of these are really funny, but when you're talking about that respect, I heard Dr. talk about repeating back what you heard, and that gives you time to think about how they may have meant it and what it means to them when they talk about the magnets. Or I had a young child tell me that she read and saw on Facebook that it was going to make her back go out. And so I did a little dance for her, and I touched my toes, and I said, I've had this shot. I got it in December and January, and my back is still doing quite well. But that was important to her because she wanted to be able to dance. And so if her back doesn't work, she can't dance. And so after she saw me touch my toes and I could do a little dance, then she said, okay, I think I'll get that. So being able to address what their concerns are in the language and in the way that they are presenting it gives them respect. I mean, she was only 13 years old, but she didn't want the shot until she knew it wasn't going to prevent her from dancing.
That's such a great example. And I wrote down here the ground game. I think we're very much in the ground game of this. And I think sometimes as leaders, everyone on this panel is a leader. I think those on this forum today are leaders in their respective areas. We like to look at authority and education and think that will drive the necessary action. And in this case, it has come at us so quickly. The scientific development has had to be so rapid that there are items, and we have to operate now on a ground game. We have to pull back, I think, and really understand in how we meet people where we are. And I think we have to address an element that, was mentioned by Dr. Joyce, and that's fear. People are fearful, and as challenged as everyone's time is currently, it's very difficult when you're 30 minutes behind to give 15 minutes you think you don't have.
Mm-hmm.
But
I agree. Also, by doing something as simple as sitting down, when the person is sitting down, for you to sit down and be at eye level and have eye contact so that they can begin to trust. And when you're talking about being 30 minutes behind, 15 minutes, you're also thinking that I don't have time to find out what's really important to these people. I need to give them the information so they'll make a good decision. Well, if they don't think care, there's nothing that you can give them that's going to make them take the shot. So finding out what's important to them, is it their children? Is it their grandmother? Is it their father? Is it where they live? Is it their job? You know, what are the things that you might be able to talk to them about that will encourage them to get the shot? And so in the African American and other brown communities, family is really important. Mm-hmm. I mean, over the top. Native Americans, I mean, we're talking about over the top. And if you can reach them at that level in relation to family, I mean, the reason I got my shot, and I don't mind telling people, my dad's 89 next week, and I had not seen him. That was not okay for me. Mm-hmm. And I mean, I knew that I needed to help other people, but my real reason was I wanted to see my dad. Mm-hmm. So I was the third person in line. In fact, I would have knocked those other two people out of the way if it hadn't been my boss and her boss. So third person in line to get the shot so that I could see my dad.
Mm-hmm. We had a great story at our vaccine clinic of two 12-year-old friends. They were had been friends, for many, many years, and well, they're 12 years. But at any rate, they came together, and when we asked them, why did you want to get this? Why did you want to get the vaccine? What was important to you? Out of both of their mouths, almost at the same time, was, I want to go see my grandparents. And again, it goes back to the family and understanding why. And they said, we don't care to wear a mask if we need to, but I really want to go see my grandparents. So as you said, finding out what is really the main reason for someone's being can really help us in trying to help with the vaccine. At the same time, when we talk about fear, we also have to remember that for us in healthcare, we're used to things changing very quickly. Our public is not. And that's where I think some of the fear came in about, not understanding the vaccine or thinking it was rushed, was simply not understanding what they were hearing from the news. Because when we hear just little sound bites, it's really hard to get a good grip on the fact that one day you don't wear masks, the next day you do wear masks. And so I think that was part of the things that also led to some of that fear that we heard from people about the vaccines.
Comments to that, Delanor?
Well, I think fear is a motivator and a detractor. I had fear of getting COVID, so it was a motivator for me. But it also is a detractor when you have a history of not being treated well or something that happened to you this week in the healthcare system. So again, to be able to break down that fear, and when I say break it down, is where does it stem from? So that you can begin to have the conversation where they are. If it's coming from their minister, who is someone that they trust, mm-hmm. then who can we redirect them to who has had a vaccine that they can trust? If it's coming from the beauty, and it's from their beautician that they've had for the last 10 years, who can we redirect them to that they do trust that has had a vaccine? So finding out where they are and meeting them there. There are a couple of other things when we talk about the African-American, brown, and other communities of color, and that is access to the vaccines. I've been working with the health department in Louisville for 10 months at least. And we've been doing these mobile missions. We started out doing the LUVACs where people would be able to drive through, but a lot of people of color couldn't get to LUVACs. And so then we started doing, when we shut Louvax down, we did mobile missions, and we would go to the community. And I had an opportunity to see areas of Louisville that I had never seen before. And I was born and raised in Louisville. And to meet communities that I had not met before, and to see people that I didn't even know existed. And so what it to me is it gave me an opportunity to have a more of a broader community focus, and to find out what things were important to those communities. And so we went to them. We went to where they worked, where they worshiped, where they lived, where they went to the grocery store. I mean, we went to them, and it made a difference that all they had to do was walk out the grocery store door and they could get a vaccine if they wanted one. And that, I think, was really important. It showed a level of caring, because in many cases, there was no way for them to get to Louvax, or there was no way for them to get to the health department, or no way to get to the global travel clinic. But when we were there in their community, supporting them, it meant something of importance.
Mm-hmm. We're starting to get some questions from our audience, and to keep them interested and keep this more dynamic, I want to go to some of these. One good one here we have from an audience member is regarding vaccine saturation. Do you believe we reached a saturation point with vaccines? This individual says they haven't talked to anyone who's unvaccinated that has any interest in becoming vaccinated.
Well, I don't believe we've reached the saturation point. And the reason I say that is the Kentucky Nurses Association, in collaboration with the Louisville Health Department, have been out, as I said, doing these mobile missions. And we meet family members who haven't made the decision yet. And so in many cases, they're there to observe, to hear, and to see what's going on. And we invite families to come, even if they don't want to get it yet. But come and listen, come and ask questions. And so I don't believe that we've reached a saturation point, and I won't give up. I will not give up.
That's great.
I agree. I don't think we've reached a saturation point either. Unfortunately, some of the people now that are saying that they will definitely get the vaccine are some of the people that are hospitalized with COVID. And, now they're saying, I should have done this sooner. Because we're seeing about a 20 to 25% of our patients hospitalized with COVID that are actually vaccinated, fully vaccinated. So it's a large percentage of our people that are being admitted with COVID that are not vaccinated. And when talking to them, they're saying, oh, yes, I'm going to go get it now. But again, we have family members that are still saying, I'm not sure. And, when we talk to them and say, your family members here in the hospital, you cannot visit them. You have to talk to them by the telephone. They're here by themselves. There's so many different issues. And again, we still just have to work. And I'm with Delanor. I'm not giving up. It's still work as much as we can to try to encourage everybody to get vaccinated. So I'm hopeful that we're not at that saturation point.
There's one other thing I'd like to add to this, and that is the listening sessions that have been happening around the communities. I think that we can't do too many of those. Mm-hmm. And these are not telling sessions. These are not preaching sessions. These truly are listening sessions where people from the community come together to tell you and to ask you questions and to tell you about their concerns. One of the things I truly appreciated about a listening session that we did at a church not too long ago was that there were as many people who were vaccinated who came as the people who had questions about vaccinations. And I was surprised about that. So I asked them, why did you come? First of all, it's my church. I care about the people who go to this church who have not been vaccinated. And I wanted them to hear from me why I got vaccinated so they could ask me questions and not just you. I felt so buoyant from that person talking about her commitment to her church, to be able to go and to be one of the people who answers the questions and to tell other people why she got the vaccination.
That's great to have that kind of testimony on getting the vaccination. And I think there's let's see, let me make a comment on that saturation, because I really had a feeling on that. And that is, I don't believe that we're at saturation on what we're doing with patients, because I think patients out there, I believe, like my preliminary comments, I think we're in the third quarter. In the third quarter, I think we can get a lot of those patients vaccinated. But what I think we have to check, I think we need to check ourselves, because I think we're saturated. Those of us who are working in healthcare, I think we can become saturated. And, we all have good days and bad days. That's the thing you have to learn about health professions and humanity in healthcare professions. You have to allow yourself to be human. Some days that compassion is going to be challenged. But we have to avoid from being saturated as professionals. But it's difficult when you see the volume coming into hospitals right now, the occupancy of ICU beds, the use of ventilators. It's very challenging. But we have to guard against that. We have to help each other. We have to give each other support. So I think the saturation question, I think, is a great one, because it works both ways. And we have to check our perceptions at the door around that one.
Dr. Wright, one of the things that the Kentucky Nurses Association did early on, because we know what was coming down the pike, is we established a program called Kentucky Nurses Helping Nurses. And we have peers to take calls. We did seminars, and some of those seminars focused on how do you get better mental health if you within a short period of time. If you only have 5 minutes, what are some of the things that you can do in those 5 minutes? And so the program is still up and running. We also have a program with the American Nurses Foundation, the national program. So I think that compassion fatigue that you're talking about is very real. Mm-hmm. And I hear from nurses, nurse leaders, I hear from academicians that they are also having the compassion fatigue. And because in many cases they want to do more, but they can't manufacture nurses. They want to do more. They can't make it so that nurses don't require sleep. They can't make it so nurses recover from all of those deaths quickly. And I say nurses, but I do mean in general, healthcare providers. I hope you know I mean that.
Yes. Okay, I'm going to jump to another question here. We've got another question in. It says, with the AMA reporting more than 96% of physicians are fully vaccinated, why is there such a hesitancy in nurses and other caregivers, which is reported as a much lower vaccination rate?
Well, is that question for me?
Well, I think I think you're thinking like I am. I think you'd be the best one to field this question.
Well, in terms of nurses, I think that there are some nurses who really just don't. They're like other people. They don't want to be told that they have to have a vaccination. However, we've been tasked with having vaccinations in healthcare since the beginning of time, so that we can be protected, so we can protect other people. And so I think that hesitancy, in many cases, they have questions that haven't been answered as well. And so we started doing a series of education classes for nurses, providing education for nurses by nurses. And we've done 4 of those so far. We have another one coming up on September the 24th. And Dr. Ruth Carrico is the doctor that's in. Mm-hmm. So it's the Dr. Ruth show. And we've had up to 117 people to attend that class across Kentucky and the nation to answer and to get questions about the COVID vaccine.
Okay. Dr. Joyce, do you have any comments on that?
I do. I think that I agree with Delano. I think one of the things that I learned, again, working with our nursing staff, is their questions were a little different than what other people had. And so they were thoughtful questions. They were questions that really needed a bit deeper dive into some of the answers. Simply saying that a messenger RNA vaccine had been around for several decades was not good enough. They wanted to know, where was it being used? How was it being used? So it really was a a better type of question from the nursing staff than from others, in the fact that it required more effort to answer it. And I was happy to do that. It was really, though, one of those things that many times, once their mind was made up, it was also sometimes much more difficult to change that. And, working at a hospital that requires vaccines now, it's part of our mandate. It is difficult when, you do lose nurses because they do not wish to be, vaccinated. And that was hard. That was hard.
Yeah.
I'm looking at the audience questions here, and I want to get to this question because it really, I think, struck at the nerve of where we are with hesitancy before we go to Dr. Tailor, and we're going to catch her up into the conversation because the audience really needs to hear her voice. But the question is, why is hesitancy growing? Is it the politics of vaccines? What are your and your guests' thoughts on how we can separate politics from science, or can we? And before any of you all jump in, I want to tell a quick story that I used with the patient, and I've used it in speaking on this vaccine. Now, there's one thing I can guarantee you about COVID-19, and it's neither red nor blue. It doesn't carry a voter registration card, and it's not going to vote in any upcoming election. It's going to try to infect hard and infect in a devastating manner for the individual and the individuals it can get to after that. So I jump right in there, and usually I try to get a joke, try to get a laugh out of people, because I find that you really have to meet people with humor. I try to take away the authoritarian role, the authoritative role, the white coat, and all of that, and just to get to someone's level. And usually humor is such a great icebreaker. So I use that to try to get away from it, and so it doesn't become a political discussion. But what are your all's thoughts? I'll go to Dr. Tailor first, but the political aspect of this. Do you have you may be the most qualified to answer this with a political science degree from UK and a medical degree. So I was thinking about this as I was preparing the bios. I'm like, I think you're well equipped here. So I turn it over to you.
I just hope my microphone is working.
Can you turn it up?
Yeah. Okay.
If you could turn it up as much as you can.
Well, I think our hardest part that has happened is that we all have our own political beliefs, and those tend to be different from someone else's. And that's okay. But Dr. Wright, you hit on the right point. COVID-19 doesn't care if you vote blue or you vote red. It just wants a body. It's doing a very good job at that. And the way that I like to approach this with my patients is to make sure that they know that I'm doing this because I want them to be healthy. This is for them and their health, their well-being, their family's well-being, and their community's well-being. That there's not some other person pulling my strings. I don't get a benefit from recommending a vaccination, because everyone always thinks that there's some ulterior motive behind. Mm-hmm. And trying to reassure them that that is not the case has been the main thing that I've been trying to emphasize.
Yeah, I had someone from our Facebook page ask, how much does KNA get paid to vaccinate people? And my response was, most of the people that work with us to do the vaccination clinics are volunteers. They get paid nothing. They get paid. You know what they get paid? The appreciation that somebody trusted them to come and get a vaccine. And they're really happy that someone came to get a vaccine. That's their payment.
Again, I agree with everybody. I think one of the things that's frustrating is, I wish from the very beginning there had been nothing political about COVID. But it just became that, unfortunately, because that is still something that people hear, they think, and it is something that we have to meet the person at their spot with that. But it is, I love Dr. Wright's comments, because again, there is not anything about this disease that could care less where you vote, how you vote, or what you vote. Because again, if it decides it's going to come after you in an unvaccinated person, it's going to do so with a vengeance.
With a vengeance.
Dr. Tailor, I'm going to go to you with the question about the patients that you've seen. You know, we're talking about vaccine hesitancy here, and maybe talk about some of your top stories that you're hearing, or your top excuses or hesitant excuses. I know that's a big one there, but
we
go
don't
ahead.
have enough time to discuss all of them, Dr. Wright. It's been amazing to me, the questions that people have come up with. One question that came up for a patient, that he was very hesitant on getting the vaccine, not because he read something on social media. He was worried he would die from the vaccine. And I had to reassure him that, sir, you are not going to die from the vaccine. Now, if you get the infection, you're at very high risk because of your heart and your history of diabetes, but you are not going to die from a vaccination. And he needed to hear that. And to us, that's like, wait a minute, why would you even consider that? But for a layman, they have no idea. They've seen movies, they're not sure. And that question was lingering in the back of his mind. When it came up with someone in their 70s and 80s, another question that's come up quite frequently with my females of childbearing age is that they're concerned for their fertility. They've seen these stories on social media. They might have friends who decided not to get the vaccination because they're concerned it could affect them later in life and could affect them with a future pregnancy. So trying to provide them accurate information has been one of the most important things that I like to emphasize to them when I see them in the office. And I share the story that my cousin, who just had her first baby, and she's older than me. So she got her vaccination at 12 weeks and just had a healthy baby girl, just to help them know that there's somebody there. Like, here's this person I can point to who's in my own family who got vaccinated, and that this vaccine did not affect the fertility at all. Like, hearing those stories seems to resonate a lot more than me just sharing data.
I think you're on mute, Delanor.
I had a young lady she brought her 2 children to get vaccinated, but she wasn't going to get vaccinated. She was pregnant, and her obstetrician actually told her not to get vaccinated. And I wanted that name, of course. But I did talk to her about how proud I was of her for bringing her children to get vaccinated. And she asked me a few questions about her baby and was it going to harm her baby? And I said, absolutely not. So she said, you know what? I'm going to take it today. I'm going to take it. And she did, with her other 2 children. And I just got a message this weekend that she is so glad that she got her vaccination. Her baby has antibodies. She said, you protected me and my baby. And, you know, when you hear those kinds of stories and you can share those, maybe they'll help someone. Maybe they'll help.
I've got another question. I've saved a couple of questions, and 2 questions are directed at the vaccine manufacturers. And so one question is about, do you feel people are hesitant because of vaccine manufacturers having liability protection with the vaccine? And 2, do you think there's hesitancy because of the profit motive with vaccine manufacturers? I've not really heard of the profit motive, but I think this is very interesting. We've had 2 questions going after the manufacturers of the vaccine. So any comments from our group?
I can honestly tell you, I have not heard that from people that I've been talking with. Their reasons are totally different. They have to do with history and how they're being treated today in the healthcare system, but not about profit and not about the manufacturers. I'm sorry, I'm not very much help on that one.
I have actually heard from my patients that they don't want to get the Johnson & Johnson vaccine because they've had some bad experience with the Johnson & Johnson product. They've heard about the talcum powder. So they do not want the Johnson & Johnson vaccine, but they're okay with Pfizer. They don't know much about Moderna. So there's not as much hesitancy there. I think with the boosters, there was some concern about profits and why are they recommending another dose of this vaccine? I already did it. So I think that component played in there, but otherwise I don't hear it very.
I have to agree. I haven't heard that either. In fact, I've heard a bit on the opposite side of some praise for the drug companies in being able to ramp up and be able to get vaccine out as quickly as they did. So I have heard that a time or two, but I've really not heard anything from the liability or profit standpoint.
I've had a couple of questions about the cost of the vaccine. People would say, no, I can't get the vaccine because I don't have any money. And it's like, you don't have to have any money. It's free. All you need is the will and a sign right here so that we can give it to you. I have had some questions about, how much does it cost? And that means that we haven't shared the right information about the cost of the vaccine. So that's an opportunity for us to make sure that people realize that it is free. It's for public health that you get the vaccine and your family gets the vaccine. And because it's the public's health that we're concerned about, not just yours, there is no cost for getting the vaccine.
I'd like to emphasize that point from Ms. Delanor, because that is another question that's come up quite often with my younger patients, the ones in their 20s. I had a 25-year-old gentleman who was thinking about getting the vaccine, but he honestly wasn't even sure if it cost him something or how he would even go about doing it. So I actually helped him sign up and reassured him, this is free. It's not going to cost you anything, but it's going to help protect us and help protect you, help protect the community in the long run. So just re-emphasizing that and showing folks how easy it is to sign up, I think that goes a long way.
We've even gone a little bit further in terms of not and having clinics. They don't have to sign up. They just show up. Just show up. We care enough that we're here. And we want you to come here so we can give you a free vaccine. You don't even have to sign up. We've done a lot of vaccines at Americana in Louisville. And I think we've given almost 1,000 vaccines there. And people just show up from many, many communities around the city.
I think this question does come up, not specific to the two questions today, but about the quality of the vaccine. And when I look at the quality of the vaccine, I look at the way it's produced. And I think Monalisa touched upon it when she talks about reputational risk. These companies are big companies and maybe they have some liability protection, but their name would always be associated if they had a bad outcome or if they had an issue with the strain or if they, no longer produce their vaccine for COVID. So the reputational risk is very financially harmful to these companies. And I try to put that into perspective because there's so many angles of argument around hesitancy. People have so many issues. And if you can try to break those down and move towards that, moving them closer to the vaccine, because I think that's what hesitancy is all about, moving them closer, not getting them to have that light bulb go off and they have the epiphany. Oh, I need to get the vaccine. I was just wrong on that issue. I didn't know it. You corrected it. Now I'm going to get it. I had a very good question come across here. The audience is doing a great job of questions. They just keep popping in here. How did the vaccine hesitancy develop? How did the vaccine hesitant develop this unfounded suspicion of healthcare professionals?
Well, I think that's something that I really think it goes back to what I mentioned earlier about things change so rapidly with COVID in the initial phases. And we would hear so many different things as far as what we should do or not do. And then the vaccine became available and we were having the same people that talked about how to treat COVID. We're now talking about the importance of the vaccine. And I think that was some of the things that led to the hesitancy. I think there was some natural skepticism again on the fact that the vaccine in many people's minds was developed so very quickly, when in actuality it wasn't. But for them, it seemed like such a short time. And so I think that is part of where we were seeing this distrust of health professionals, simply because we did have to change our story. I mean, I remember telling people, no, you don't have to wear a mask. And then I remember a few weeks later saying, yes, you do. So it was, I think those are some of the things that led to that skepticism of whether or not that the public was being told the truth.
I'd like to expand on that a little bit, because I think you're absolutely right, Dr. Joyce. But I think what we did in healthcare is we didn't explain the why. When we first started out, no mask, it was because there were no masks. And we wanted the health workers to get the mask, and so that they could have them in the hospital. But we didn't explain that. We just said, you don't need to wear a mask. Okay. So as things have evolved with the virus, so has our conversation and our instructions to communities. And what we need to make sure they understand is the virus isn't static. It's not staying the same. And so our communication and recommendations and guidance can't stay the same. It's like if you are trying to put a square peg into a round hole. If you shave off the sides so that it can fit into the round space, there's a chance that that'll work. But if you keep trying to put that square peg into that round hole, it's never going to work. So the key is that we are changing as the virus is changing, our recommendations, our instructions, our guidance. We would be remiss if we didn't change as the virus is changing. And it would be even more deadly.
This audience is doing a great job here. I've got 2 questions, and I know we're coming down to our last 10 minutes. Let me go to this one. Some people say they prefer to get immunity from the disease rather than a vaccine. Or if they already have had COVID, they believe they don't need the vaccine. Can you respond?
I'm going to leave that to Dr. Tailor.
I got you on this one. So I've been sharing with my patients the stories of the long COVID, these post-COVID symptoms that a lot of my patients are actually dealing with. I've given the example of my almost 70-year-old gentleman who spent 40 days in the hospital in March of 2020, about 4 months in rehab. And we're still finding stuff that is happening because of COVID-19. Like, for example, it affects your gums. So he's having to have a lot of dental work and procedures done now because of tooth loss. We're still dealing with the tiredness, the fatigue, the shortness of breath, which is finally started to get better. But this virus is unlike the others that we've seen in terms of these post-infection symptoms. Another lady I have is in her 40s. She also had COVID early on. She's dealing with the same dental issues. The brain fog has been the worst for her. And it's actually made it very difficult for her back into the workforce, because the things that she was able to do, like easily calculate tips and make those mathematical connections that were very simple for her, are no longer simple. And so if this virus was like the other ones that we usually encounter with colds, like, we probably wouldn't most symptoms that we would be discussing. But unfortunately with COVID-19, this virus doesn't like to go away. It seems to find other things to do. And so that is my main reason to emphasize to my patients, please, please, please get the vaccine, because I would rather you get the vaccine than get sick from this infection. And then you and I are trying to figure out what else is going to happen because of this virus.
Yeah.
Well said. Let's go to another question. What do you believe is the source of most reasons behind vaccine hesitancy? And what are your recommendations for finding truthful information? So why do we have hesitancy, and where do we go for the truth?
Well, I'll take the go-to for the truth first, and I'll give somebody else on the hesitancy. I've been addressing the hesitancy. I suggest the CDC, and I think the CDC is doing a much better job in making their FAQs and their search engine information readable and understandable. And they've been doing a lot of infographics that help people to be able to put together the story of how it all works. So I really like that. I also think that our public health department for Kentucky has done a phenomenal job in resource materials. Is a great go-to place. So and the other thing is to get information from people that you trust, who are also getting information from places they trust. So trusting the science. And the idea that you're going to get and I heard Dr. Stack talk about plumbers at the end of his talk, that you don't let them put the pipes together with duct tape. Well, part of the reason that we have physicians and nurse practitioners and these public health officials who are giving us this information is that they have the science background to give us the right information. We trust them to give us the science, get the information, and that they're not would probably use the duct tape.
We're coming full circle here. The other half of that question is, why do we have hesitancy?
I think there's always been hesitancy for different things. I mean, I think we always, every year we always deal with the people who don't wish to get the flu vaccine. We have people who do not want to get the shingles vaccine. So I think it's just one of those things that there's always been hesitancy about vaccines. It's a different time today than it was years ago when all of the children lined up for a polio vaccine and got their sugar cube and went on about their merry way. It is a different world, but at the same time, I think there's always been degrees of hesitancy when it comes to vaccines. And I think this has just been magnified because of this horrible pandemic that we've all lived through.
I'll come back to a comment we made earlier. People are fearful. And I think when you think about fear is a tool sometimes in human evolution to keep people safe. Mm-hmm. And we're arguing about something as well here in vaccines to keep people safe. So people have this, conflicting interest here. They're in their fear. So which element of fear is going to win out? And I think fear is to me, that's been the epiphany for me during this panel is how much fear plays into this for people. I'm keeping watching our time. We're down to 4 minutes. We've got 2 questions here. Here's a quick one. When getting the vaccine, you are asked what insurance you have. Why ask if it is free?
Mainly because the vaccine itself is free. However, if an organization provides it for you, if you have insurance, then they can get reimbursed for actually providing the person who provides the vaccine. So you're not paying for the cost of the vaccine, you're providing for the person who's actually providing the actual the person who's going to provide the vaccine. So, and if you don't have insurance, that's okay. We're still going to give you the vaccine.
Very good. The other question that was asked earlier, and I wanted Dr. Tailor to be here for this, any scientific reasons not to get the COVID-19 vaccine?
I think the big thing that has come down for that in terms of a reason not to get the vaccine, the main one would be allergies. And if folks have a very severe allergy, I believe it's polyethylene glycol vaccine, that would be a reason to be hesitant or make sure that you're in a safe place to get the vaccination. So that way, if you need something, they can provide an EpiPen and help take care of you. I think the other component is polysorbate, which is in the Johnson & Johnson vaccination. Those would be the main reasons to not get the vaccine. Obviously, there are going to be some very particular cases, like I've had patients with multiple sclerosis, medications for their disease who've had to time the vaccination in accordance with their infusion. But those kinds of situations are going to be few and far between. So my main reason would be allergies and making sure you're in a safe place to receive a vaccination.
Very good. Yes, those, and some people may be within a quarantine window. They need to pause, but that wouldn't prevent them from ultimately getting the vaccine. I'm looking at our time. We're coming within the last minute. I want to thank all of our panelists. This has been an excellent discussion. We could continue all afternoon, and I think hesitancy will be a topic of conversation all throughout the day. And I look forward to hearing stories of success on how people overcome hesitancy. It's getting tougher. The incline, the slope is higher now. We're getting into that third and fourth quarter, probably mid-third quarter, and getting these people. I mean, really, we're going to get there. We're going to get there, and we have to balance our frustrations with the frustrations of our patients, and it's a real ground game. We really have to step back and take, I would say, those extra 10 to 15 minutes to make sure we educate our patients and help them understand how important this is as we peel away all of the misperceptions about what is going on, the redness of this, the blueness of this, all of the insanity that surrounds it, and just talk to people like human beings and convey to them, like we've gotten into this profession, how much we want to help them. And we'll be able to get through this because there's no pathway through this without vaccination. Thank you all today for your time and your expertise. It's so very much appreciated.